Okay, thank you so much for joining us today. Sorry about that rough start. We wanted to welcome you all to our event today. The event is titled, How Can Your HIV/AIDS Organization Leverage Data to Enhance Care Coordination? And we are going to be talking about the HIV awareness and helping to empower all people everywhere to access services to improve their quality of life. As communities look to care coordination and using the services available to living with these things, the data management aspect is critically important. Today we are joined by Sarah, who works here at ClientTrack as a project analyst, and Joel Ritsema, I'm sorry, I keep trying to say that right, Ritsema, the Associate Director of Research, Evaluation, and Data Services at the AIDS Foundation of Chicago. Joel, thank you so much for joining us. We're really looking forward to hearing about how you've used ClientTrack to help all those people that you're serving in your area in Chicago. We also have Stacy Berta here with us, and she's going to help to answer questions about ClientTrack and using it specifically for this particular type of audience. We'll have an opportunity at the end to ask questions and answer those live. So if you can all just use the chat button on the bottom right, or you can ask questions. We will try to answer them during the event or verbally at the end of today's event. So again, thank you so much for joining us, and we'll be talking a little bit, we're going to have Sarah start out talking a little bit about the program and about how she works with this particular audience, and so we'll go from there. Sarah, go ahead.
Great, thank you so much. I've worked on the front lines with HIV/AIDS prevention in terms of testing and care coordination for quite a few years before I came to ClientTrack. And so having that frontline experience, it's easy to see how important investing in technology can be when it comes to meeting this national HIV/AIDS strategy. I think everyone on the phone is very familiar with that strategy. We see it at conferences and at meetings all the time. But I'd ask and challenge you all, how do we meet the goals and align our goals at our individual organizations to meet this strategy? In terms of reducing new HIV infections, what technology, what tools do we have in place to track how many tests are being done each day, each month by which frontline staff, and what's our incidence locally, and how do we share that data with our community partners to watch for trends? We all have community health departments that can help with that, state health departments that can help with those trends, but sometimes we get that data a year or two down the road when trends have already changed. So what tools do we have right now at this moment to see where we're seeing new HIV infections? What's the geographic region for that incidence? And then in terms of increasing access to care and improving health outcomes for people who are living with HIV or AIDS, how do we show a linkage to care? That's one important thing with care coordination, is showing that linkage to care. And so how do we show that a client or one of the individuals we're working with showed up for their appointment with the physician or showed up to an appointment with a community provider? What tools or what systems do we have in place where we can record that referral, that successful outcome of the referral, and note that that person moved into care? And then how do we reduce HIV-related health disparities? How can a case manager look quickly across their caseload and see the viral load of all of their clients that they're currently working with and note that they've decreased by 20%, or that all of their Latino clients have an undetectable viral load? I think the tools for meeting this HIV/AIDS strategy are out there, and then I would challenge us all to invest in ways to meet that strategy, both within our organizations, within our communities, and nationwide.
Okay, great. Thank you so much, Sarah, for talking about that. Joel, we'd like to get started with you and talking about the strategy of how you're using ClientTrack in managing the data for your particular organization. Joel, can you hear me?
Yes, I'm here.
Okay, great. Sorry, I think we're still having some audio issues, but I wanted to introduce Joel. Again, he's the Associate Director of Research, Evaluation, and Data Services for the AIDS Foundation of Chicago. He's worked in research and evaluation for a number of years, since 2008, and his organization does data support for the HIV care, housing and development departments across multiple data systems. He has a wonderful 18-month-old daughter and 2 Yabby dogs. We've all been sharing stories about our dogs today. And he's also in progress of completing his PhD in sociology at Loyola University Chicago. Joel, we're excited to have you joining us today. Please go ahead.
Okay, thank you so much for that introduction. Yes, I work at the AIDS Foundation of Chicago. We were established in 1985, and we've worked both locally and nationally in the fight against HIV and AIDS. We work in a network of more than 60 providers, HIV care and housing and other services. We offer advocacy, case management, supportive housing, prevention, and capacity building. So we're the care coordinator for 60 agencies that provide direct services. So, next slide, please. So basically, I wanted to talk today just about some of the challenges that we've faced, both program-related and data-related, in my tenure and in AFC's tenure in our existence, working with HIV/AIDS, and so the challenges we faced, and also how we've addressed those challenges and how we continue to address those challenges. So the first challenge I wanted to talk about is related to the fact that we're situated in a constantly changing field. So we're situated in Chicago, and like most places, we experience changing demographics. Certainly since 1985, there have been profound changes, and things are constantly moving and shifting, both related to HIV/AIDS and to homelessness. Chicago is one of the most racially and class segregated cities in the United States, and deals with a number of different demographic shifts over the years related to policy, economics, politics, etc. The field's also changing due to funder requirements. So we bring in funding from a number of different sources, and those funder requirements change as we gain funders, lose funders, as funders change their mind about what they want, and so we have to be on our toes in regards to that. We also see changes in regards to policy. So in terms of housing policy, Chicago about 15 years ago implemented the 10-year plan to end homelessness. Of course, once that 10 years was completed, homelessness was not eradicated in Chicago, and so now it's just referred to as the plan to end homelessness. And with this started out as sort of a very aggressive policy designed to eradicate homelessness and move people into long-term stable housing. Since its inception, those policies and financial support for those policies have slowly been eroded, and so we've had to sort of deal with all of these changes over the years. In terms of HIV care policy, the big change was with the Affordable Care Act. A lot of folks weren't sure exactly what was going to happen to Ryan White funding with the introduction of the ACA, and so we did a lot of sort of strategizing and thinking ahead as to what that means for our organization, what that means for our clients moving forward. So, next please. So another challenge that we face related to these changes is using and coordinating multiple data systems. So this is a requirement that we're sort of, like a lot of different agencies are sort of stuck with, right? So we have funder data collection requirements that change from grant year to grant year. This involves how data elements are collected, what they want us to collect, how they want to see it, how they want it disseminated, and so on and so forth. In addition to the data itself, how the data is stored is also something, and reported is also something that we deal with. So a number of our funders mandate that we use particular systems, whether it's HUD or the state of Illinois. So we sort of are beholden to funder requirements in terms of where we put the data. Client Track is on here under funder mandated systems. However, there aren't any funders that mandate we use Client Track. Client Track is a system that we chose ourselves and have used for a number of years now. And so it's on there, but it's not mandated by anybody. Next. So the biggest way that, sort of the general sweeping way that we deal with these challenges is to try to maintain a flexible data infrastructure and organizational flexibility. And this primarily has to do with being flexible in our methods for collecting and disseminating data. And so a big priority for us as an organization is to have a system that first of all is highly customizable, and that we can customize and change forms and fields in a really timely fashion, and also a system that plays well for others. So because we have to work with these funder mandated systems, it's really important for us as an organization to have our own data system that can take imports and exports easily and frequently, and so on and so forth. And ClientTrack we primarily use ClientTrack as our data warehouse, and so we push data into ClientTrack from other databases. We push data out of ClientTrack into other databases, and we also do direct entry into ClientTrack as well. So another way that we address these challenges is to maintain open communication about what is going on in our communities. Being aware of community needs, like I said, Chicago is this very segregated place, and because of that, communities within the city, within the region that we serve, sort of have very different needs depending on where they're situated within this sort of web of, and then also in terms of methods and best practices. So it's really, really vital that we sort of maintain this relationship with our communities. And so some of the ways that we do this is that we emphasize hiring people from within the communities to work at our organization, so they live in these communities, they breathe these communities, and can bring that knowledge into our organization. We also have consumer advisory boards, both for AFC, and also we require consumer advisory boards for all the case management agencies that we fund to try to maintain an open line of communication with the clients that we serve. Each year we also conduct client satisfaction surveys for all case managed clients in our region. So, okay, next slide. Another challenge that we deal with is, and I think this is one that probably resonates with a lot of folks who work with data and also work with practitioners or case managers, and that's trying to balance the case manager's data entry burden with our needs in research and evaluation. So case managers' primary goal is to work with clients, right? To be out in the field, connecting clients to care, meeting with their clients, completing assessments, finding resources for their clients, etc. So that's their primary goal. But they also have to document all of that for us and for our funders. And because of this, they often have to enter data into multiple systems. So worst case scenario, case managers work for an agency that has their own internal system for reporting that they have to enter data into. They also have to report to us, so they have to provide us with data, and perhaps their agency has other funders that they also have to report to. So there's potential for a lot of duplicate data entry, and that's something that we want to avoid. So obviously we need clean and complete data so we can accurately measure what's happening, what case managers are doing, what our agencies are doing, and how they're meeting our clients' needs or not, and to be able to have that in a sort of a reliable way. But obviously case managers are more focused on caring for clients than entering data, which is how it should be, but it sort of presents a challenge for us on the data side. So, next slide. So we are evaluators and we are reporters. We have to report to the funders, but I think the biggest issue for us is to keep in mind what the primary role of the case manager is, and that's to focus on client care. And so it's sort of a mindset that we have to maintain, which is difficult, especially when we're just working with data so much, but to sort of recognize our role versus the case manager's role. And we should shoulder the responsibility as much as possible in terms of data entry and data quality and evaluation, and not push it off on the case managers where it's avoidable. Obviously, case managers are the ones who are working with the clients and need to enter the data for us to work with, but recognizing the distinction in these two roles and being able to do as much as we can to make the case manager's life easier is something that we see as really important. And this means sort of reducing the burden as much as possible so they don't have to do double duty or double data entry and also take care of their clients. For example, we also conduct case manager satisfaction surveys and try to maintain open relationships with our case managers so we get a sense of how things are going for them, what can be improved, and also having a data system that is flexible and customizable so we can change it. So if case managers have a better idea for how to collect the data or an easier way to do it, if it works with what we need in terms of reporting, that's something that we can do as long as we have a system that's flexible to do that. So, okay, next slide. Okay. Another challenge is monitoring and improving data quality. So because we work with so many different organizations, we have a lot of data of varying quality, of varying reliability. And when we're trying to have these data-driven measures of performance and client outcomes, that presents an ongoing challenge. So some of the questions that we have that we constantly grapple with are how to translate this data into funder-friendly measurements or funder-friendly outcomes. How can we make the data that we have usable for evaluation and potentially for research? And also, how can we use this data to increase accountability both for providing quality data and for ensuring that our clients are receiving the services and the care that they need? So that's an ongoing challenge that we face being such a large organization. So, next. So, I think the big lesson that we've dealt with in trying to overcome this challenge over the years is to very clearly and purposefully identify what it is that we want our agency to do and what it is that we want our funded case management agencies to do as well. And once we've identified exactly in measurable ways what we want to accomplish, what we want to do, these actions, to set very clear expectations for the agencies that we work with from the top down or the bottom up, right? And then once we have these clear expectations set, once they're clearly communicated, to regularly monitor the data for those outcomes. And so we're able to pull through Client Track. Client Track allows us to use SQL, Crystal reports. It integrates with Crystal reports. There are also other reporting tools like Data Explorer. And so we're able to pull monthly, quarterly, annual, and real-time reports to be able to monitor these outcomes on a regular basis. And this includes outcomes like viral load suppression, which is sort of the primary measurement, quick and dirty measurement of client health, at least related to HIV and AIDS. To be able to monitor clients' insurance status. This is becoming increasingly important, has become increasingly important with the Affordable Care Act, being able to ensure that our clients are connected to insurance. And then sort of programmatic things like client engagement and case management, how often case managers meet with the clients, the types of interactions that they have, also client assessments completed, whether clients completed their intake, their follow-ups, their exit assessments, etc. And then client engagement and care, how often did they go to the doctor, do they have to go to the ER for any reason, these sorts of things. Those are the types of outcomes that we track and monitor on a regular basis. So, next. And as we track this data, we've developed dashboards and regular reports for our agencies to allow them to see what we're tracking and what their agency looks like, or their performance. So we produce these agency and program-specific dashboards that provide just sort of a snapshot on a monthly or quarterly basis of how their agency is doing, the clients that they're serving, and so included in these dashboards are demographic data, outcomes like those mentioned on the previous slide, and other information that's of interest to case management agencies. And case managers, supervisors are able to use these dashboards to identify where there are gaps in the services, at least in terms of data, and they're able to then evaluate more clearly whether case managers are underperforming in terms of the services that they're providing, or whether there are issues with data entry. So maybe they're doing the work, but it's just not showing up in the data. And so these dashboards and other reports that we use are a really good way for us to demonstrate that we're actually using the data that they provide. So before we had this sort of regular reporting procedure or protocol in place, I think it was difficult for our funded agencies and for case managers to see the value in their reporting. And so they would send all this data, they would enter all this data, and then they would have no idea what happened to it, right, or how it's used. And so being able to have these very clear deliverables for our agencies and for our case managers is something that I think is really valuable. And so agencies are able to identify gaps in their services. They're able to see where we're missing data, and then they're able to sort of make improvements around that. And sometimes it requires us to provide targeted technical assistance to case management agencies that are struggling. But what we've seen since we've started doing this is that agencies, by and large, have improved in terms of their data quality and their performance. And I think a lot of this has to do with the fact that they're actually able to see how we're using the data, why it's important, and they're able to take that value and make sense of it as they're working with their clients and then documenting what they're doing. So, and then sort of the final outcome that we've had based upon this regular reporting is being able to implement a targeted or a tiered case management program. And so we're able to see at both the client level and at the aggregate level, for example, unsuppressed clients, or clients with unsuppressed viral loads, clients who aren't engaged in care or aren't engaged with their case manager. And so we're able to work with case management agencies and target those specific clients that seem to be sort of slipping through the cracks. And that's something that really, I think, helps overall, and certainly helps those specific clients who are in danger of disengaging from care. So. Next slide. I think that's it for me.
Yes, thank you so much, Joel. That was especially helpful. And, you know, so often we do all this work, and it's really difficult to show those outcomes and show how it's impacting various individuals. I love the dashboards that you all are using, and Stacy is going to take us through some of those and then talk specifically about some of the reports. So those people who are watching and listening today, I'd like to introduce Stacy Berta. She is a solutions engineer here at ClientTrack, and she works directly to craft the solutions that individual organizations need. And we work with those dashboards so you can really see what is being impacted in your organization, and then those reports that are often necessary to truly quantify the results that you're able to achieve and increase your funding, et cetera. So Stacy, I'm going to turn the time over to you and have you do a demo of ClientTrack and show those different things to our audience.
Great, thank you, Amy. Thank you again, Joel. Your description and explanation of your challenges and your focused areas on overcoming those challenges is super beneficial. Today, I'm going to take just a few minutes and jump into ClientTrack and walk through some features and capabilities that ClientTrack can provide as a tool to overcome some of those challenges, better track data and hopefully utilize these tools to help those case managers and those workers really focus on their daily needs and items. I am logged into a client track environment. For those of you who may not have seen before, I'll take a quick look at the navigation and what that looks like in client track. We have multiple tabs at the top that represent different sets of data that we may look at. The Home tab is really a place for me as a user to see the information at an organization level or a program level, to really see some data a little more generic. So as Joel spoke about dashboards, we have information that can be configured and provided based on the user's needs and their role within the organization to get them the most useful information as they first log in and take a look at the data that's in the system and what's available to them. It may be current enrollments or case assignments that they're working on a day-to-day basis, to really get a glance at what they're working with and where their focus is. You can utilize charts and different pieces within this dashboard to really present that information. On the left side, we have menu options that are specific to this tab that can help me work with this data and really use this tool effectively. From basic information I use on a day-to-day basis to reporting options, which we'll jump into a little bit later. A lot of our case managers work one-on-one on the client tab individually as they work with those individuals to really coordinate that care and provide the work and information with those clients. We also can look at information at a housing level and manage those housing facilities that you may work with, as well as community providers that you may partner with and work closely with your clients, as well as volunteer data, grant data, and then tracking those suggestions and issues in the system that you may need to look at. We're going to jump right into the Clients tab and talk through a couple of features that may help as you're looking at collecting data for multiple funding sources and doing that in an efficient, effective way to save time and effectively get that data for that reporting and analysis down the road. I'm going to start with a feature in Client Track that is doing test sessions. This model that we're going to look at today is based off of the CDC's evaluation web model, which can be a great feature as you enter and do those test sessions. If you're entering into eval web, you can enter that data into Client Track and use the CDC export features to export that data to the CDC. So a great feature that we'll talk through today. In this case, as we click on test sessions, we can see if the individual we're working with has any previous sessions. In this case, I have Holly Jarvison as the client I've selected, and Holly has not previously had a session recorded. I'm going to add a test session. In this case, it'll walk me through all those critical elements necessary as I go through those testing sessions. So in this case, I can review Holly's basic information. You can see that within this form, we have asterisks to identify what fields are required. So as you look at your system and the data you need to collect and report on down the line, making this a simple process that users are required to enter that necessary information and may have the option to enter information they may have that may serve their needs as they're working with their clients. We can see here that we may not have a Social Security number on file for Holly, and we can see that previously it's marked as data not collected. With logic built into this form, we can recognize that I now have entered that information and that data quality element has gone away. It's recognizing that I now have a Social Security number on record, and there's no longer a need for the case manager to consider or think about that information. So being able to hide and display information only when necessary can really streamline the process and make this more efficient and time effective for those users. You can see we have several fields. We'll walk through this fairly fast, including gender and the family information associated with this client. We can track a number of information if that's beneficial for you. Client Track security model allows for very flexible use of information to help collaborate within your internal organization and really utilize that data effectively across different teams in your organization. The security model can be configured to match your use case and what needs. So a user may be able to see and access information without having to recollect that information from the client again. Or if that information is secure and needs to be confidential, you can define which users have access to that information. At this point, we're setting up a few preconditions related to the testing portion. Which grant is being applied? Which grant is covering? In this case, we'll consider it a CDC AIDS testing grant that is funding this process. We can identify the site name and where this information is being taken. You can see here we have a general list, but that site list can be defined for those sites that you regularly perform testing and record that accurately. We can identify if this client has had a previous HIV test. If yes, we can identify their self-reported results. If that was positive or negative, in this case, we'll say yes, and it was positive. Our next step within this workflow is a document checklist, and this is a feature to allow us to consider any information we need to verify that we have on file as we go through and complete this testing. In this case, it may be consent and documentation that they understand the process and the rules and regulations around this testing. I'm going to identify that, yes, we have that, and we have that on file so that we can recognize this. One item I want to mention within Client Track that we're walking through, and you can see this on the left side, is a workflow that connects different steps that you may need to accomplish in a regular routine you do on a regular basis. In this case, it's testing, so we can see which steps we've gone through and where we are in that process. Through the workflow, we can make sure users have a very efficient process to walk through and make sure we collect the same information and have that same experience for every client coming through and going through those testing sessions. We'll save and close. At this point, we take us into the Wisc Assessment and identifying those risks. Our first step is identifying if we've completed that behavior risk profile. And we can say if yes, we have completed that profile, we can identify the risk factors that are identified within that assessment. So really collecting this information in a streamlined, useful fashion. We can also identify that maybe we were asked, but there are no risks identified, so that's a streamlined, simple process. At this point, we get into the test and test results itself and being able to take a look at the information that was collected. So the test selection, are they choosing to be confidential or anonymous within this test? The technology being used, and then the end results of those tests, whether that's positive, negative, indeterminate, and then if those results were provided to that client. If the answer is no, we're going to want to know why. Why is that not being provided to that client? So that we have that information necessary for that CDC funding source, and we're collecting that information as we move forward. In this case, we also have the opportunity to write a case note and write some individual information from that case manager, that individual doing that testing, that really helps you document that interaction and that information. This gives you a free text field to really enter those details based on your policies and needs. We also have the ability at the bottom to identify any services that are provided as we're working with that individual. In this case, we may speak one-on-one with that client about their test results, and we may provide a specific set of education or other services that may apply to help them as they go through this process. So being able to track not only those notes and that interaction with that client, but any other services you may be offering and giving to that individual as you're working with them. My apologies. I missed a required step. This is a great example of what the system can do to ensure that the necessary data you need for reporting purposes is required. And if something gets overlooked, it'll remind you and make sure you go back and enter that information. At this point, it's taking us specifically to referrals that are related to the testing session we just completed and what referrals may be necessary based on their test results to make sure they have that best coordination of care and receive that next step in the process. So in this case, we look at each individual. Are we referring them to a HIV medical care, yes or no? If yes, we then see additional information about what referral we're making. Are we sending them for medical supplies, maybe medication management, or mental health services, and then identifying who we're referring them to and connecting them to. This search can offer a list of providers that only offer the service we're referring them for, which gives you a streamlined method to help your team know the best locations, those locations in your community you work with to provide those services. You can also identify outcome information. If you have an appointment that maybe you reached out and scheduled that appointment with them, you can record that information, the long-term result of that, to be able to track their ongoing care. At this point, we don't know if they've attended that first appointment yet. We'll mark that as such. You can do the same for partner services. I'm going to click no just for moving forward, as well as prevention services, and identifying the client's most severe housing status in the last 12 months, a necessary component for certain funding sources that you'll want to collect, and this offers that opportunity to collect that information as well. Beyond these basic referral types that we anticipate doing in relation to the testing session we're doing, we have the ability to add additional referrals to any other organization that we see benefiting this client. So in this case, we'll identify the referral, which service we're referring to, and again, identify which provider we are connecting them with. You can see we have the ability to add multiple referrals and just identify each and every source that we're connecting them with. At this point, it's identifying we've completed the workflow and all the necessary steps within this testing session. The workflow truly is a great feature to really streamline that data collection process and get that necessary data for those funding sources down the line. ClientTrack has additional testing features, and as I mentioned before, the ability to configure this solution to truly meet your needs and specific goals you have. So that scenario really walks through an HIV testing session, but the ability to configure a workflow to also do any other testing types you may do, whether it's STD testing, Hep C testing, that sort of thing, you can really configure that workflow to really meet your testing needs and what that looks like. In addition, you can track lab orders and integrate with a lab in particular as you complete those tests and send out those lab orders and receive those results back into the system automatically through an integration in ClientTrack. Though I won't show you the actual integration process today, I do want to point out a feature where you would be able to access, enter those orders and see that. And again, this can be built in directly into a workflow or whatever method works best with your agency's process and flow to make it as convenient as possible. In this case, you'd enter the lab in which you're sending those orders to. Identify which test you may be providing, the collection date, time, the reason those the status, maybe we're requesting that lab order, the specimen type, and the source site. You can identify the file order number, comments, and any additional fields necessary for your organization as you enter those labs and work with those lab tests. At this point, we now have that history of that lab test, and we can identify and record results in relation to those tests that have now been taken. So we can identify again the test that was taken, the observer, if that is important information. I won't go ahead, but this search option allows you to identify any provider, any user in the system that may be an observer for that lab, the unit, the value type, the result date, and the status of that result. In this case, it is a generic result, but the ability to configure and record the specific values and results of that and pull that in automatically from the lab allows great flexibility and ease of transition and can improve the lab time in getting those results back sometime down to just a couple of days and get that information directly into the system. Looks like we have just a little bit of time left. I'm going to take a quick minute and walk through one more workflow with you quickly to identify kind of some additional data collection points that may be beneficial depending on the funding source you may have. So I'm going to walk through a Ryan White RSR intake process, which is built around Ryan White funding requirements, but can also be flexible enough to collect information meeting your community's needs as well as other funding sources. In this case, I'm going to immediately identify if I'm going to intake a new client or use the current client selected. For time purposes today, I'll select Holly and work with Holly again as well. In this case, we can see we have Holly and all of her information. The case manager has the option to update that information. I'm going to identify no additional changes. We're creating a general assessment point that will link any other data we collect at this point in time together so that we can analyze this data in the future and provide this data for reporting needs as all the information collected at that entry point. Again, in the matter of time, I'm going to take a look, and I have an entry assessment already on file for Holly, so I'm going to select and update that information. The very first assessment we have within this process is the HIV status assessment. We can identify, again, extensive use of logic behind the scenes to identify what's necessary. If Holly was HIV negative, I would have no additional information I would need to collect on her HIV status. However, because she is HIV positive, there is additional information I need to know. In this case, we'll identify that her first HIV/AIDS test was December 1st of last year, and it's not AIDS at this time. Hit save. Oh. I did overlook a required field as a result of her HIV positive, and that is that link to that outpatient ambulatory medical care provider. So we'll identify a date. We now have the opportunity to review the financial assessment for Holly and update that information. So your administrator can configure what types of income and expenses and non-cash benefits you want to collect and see the information on. And then at this point, we can identify if this individual collects that sort of income or benefits and record that information. Our next form allows us to have the opportunity to collect universal data information for agencies and programs that may be federally funded through HUD. And this is a standard data set that's often used. And with any workflow, we can identify whether this information should be collected based on the funding a certain program has, or if this is information we want to collect on anyone coming in, that this is useful information for our community to review, taking a look at their residents prior to program entry. Maybe they are renting and they've been there more than 3 months but less than a year. We can identify if they qualify as continuously homeless, particularly for housing programs. This is common data collected within the organization. We will collect a few pieces. We can also see in this case we're identifying the health insurance and if this individual has health insurance. We can identify yes or no, and then identify the specific types of health insurance on file directly below. We can see here we have a risk factors assessment. This is an example of another way to collect that risk assessment we looked at in the test sessions and some of the flexibility in how that can be presented to your users in different ways to make it really align with your goals and needs and streamline that data collection. We can track and identify any other screenings that are being completed. So maybe we identified we did do a mental health screening for this individual yesterday, and whether we have follow-up needed. So really the flexibility to identify whatever screenings your agency and community uses and identifying whether those were completed with a given client at any time. Therapies allows us to identify any therapies that may be utilized as this client works with us, whether it be heart or prophylaxis or any other therapy that you may generally track and utilize, being able to identify the date that was prescribed or recommended, their current status, the date they started, ended, and any notes related to the therapy they're receiving. The enrollment allows us to recognize the period of time in which this client is working closely with our agency and can be a beneficial way to really take a look at the period of time you're serving clients and report on that globally. In this case, we will enroll Holly in the CARE program. Again, this step allows us to create referrals and really take a look at that care coordination aspect and linking them to those other agencies that can work with our clients. Since we kind of looked at that on the test sessions, I will skip over that briefly. Again, the case notes for services to allow you to record that interaction, those notes about those interactions, and then the services that may be provided at this point in time. And we have finished that workflow. I went a little longer than I planned. I apologize. I was planning to jump into Data Explorer and some reporting features for Ryan White, but it does look like we're out of time, so I apologize for walking through that workflow a little longer than I intended.
Stacey, thank you so much. I think that everyone will appreciate the detail and can get a better understanding of really what the opportunity is to have for how to use this workflow in their own environment. I would invite any of you who have questions or want to see something specific regarding our reporting features to reach out to us directly. You can either send me an email at aberkner@clienttrack.com. That is spelled A, B as in boy, IRKNER @clienttrack.com, or just send us a question on the menu bar on the right-hand side of your screen. You can either do the chat or the questions, and we'll be happy to get back to you immediately. Thank you again today for joining. Joel, thank you again for participating with us today. It was very helpful. And Stacey and Sarah, thank you to both of you. We will have this available as a recording probably by tomorrow. So if you have any questions, please feel free to reach out to us today, or we will have the recording available tomorrow online. Thanks so much, everyone. Bye-bye.